everyone, just a quick guide here on sagittal and coronal reconstructions of the shoulder. And as you watch this, just try to remember the audience includes both new and experienced CT techs, and trying to balance a clear overview without oversimplifying things is a challenge. When scanning shoulders, you should have your patient positioned like this on the table. Alright, I'm sorry, I couldn't help myself with that. Actually, the patient should be positioned like this, arm down by their side, thumb up towards the ceiling. Sagittal shoulders should match the same angle as a Y-view x-ray. When choosing how to angle the reconstruction planes, you first need to scroll through the axial images to find the one that best displays the largest part of the scapular body. An image that looks similar to this. From here, you just need to rotate the green line so it's parallel with the scapula. When adjusting the box, it's essential to pay attention to the orange dashes along the box. I've extended these with a blue dashed line for clarity. These lines indicate the orientation of the slices as they pass through the anatomy. Also take note of the arrows as these represent the direction of the slices. For the sagittals, we want the series to go from lateral to medial, which is what is indicated by the direction of these arrows. Next, we need to adjust the reconstruction plane for the image on the left. The goal is to align the sagittals to intersect the humerus in a single plane rather than in segments. To achieve this, simply rotate the red reference line on the left image so that it runs parallel to the humerus. And there you have it, a pretty good sagittal. A coronal shoulder CT is basically just a really great Grashy view, except it's super fun to do it on CT. Actually, it's pretty much exactly the same as what we did with the sagittals. As you can see, green line again, rotate it so it's parallel with the scapula. And the only difference, now the dashes are on the other sides of the box. I extended these with the blue dashes again. These represent the orientation of the slices as they run through the body. Again, note the arrows. In this case, we want them running from anterior to posterior. Once we have accounted for the rotation of the scapula, we need to address the natural tilt of the scapula, like the anterior to posterior tilt. We want the angle of the images to match the angle of the scapula, like this. Not like this. To accomplish this on the scanner, we just need to go to the image on the right, rotate that green line so it is parallel with the scapula. This allows us to see the glenohumeral joint all in the same plane, as shown on now the image on the left. In this example, the scapula and humerus are at different angles, and if this is the case, we should always base our reconstruction planes on the angle of the scapula, not the humerus. I confirmed this with both Dr. McGuire and Dr. Marcoux. If we were to match the angle of the humerus, as shown here, it would result in a distorted final image, as shown on the image on the left now. Now, it should be noted that if the patient is scanned with their arm in a neutral location by their side, the angle of the humerus and the angle of the scapula will nearly always be the same. But if you run into this, remember to match the angle of the scapula rather than the angle of the humerus. And there you have it, a pretty good coronal, with the entire glenohumeral joint in the same plane. Happy reconstructing. Thanks.